It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives. Changing lives. Changing lives for the better. For the better. Changing lives.
Hi again, everyone. I'm Candace Kruger along with Jim Knox, and we're back again with another edition of the Best Docs Network, featuring some of the best doctors in all of the Dallas and Fort Worth area that are helping to change people's lives.
And Candace, speaking of best doctors, we'll open up with one of the best bariatric surgeons in the entire Dallas-Fort Worth area. It is Dr. Scott Stowers from Bariatric Solutions.
I've experienced in my past excessive weight gain. I would diet, lose, gain, lose. I was embarrassed. I was ashamed. I didn't feel good, and the more I gained, the less I felt confidence. I had made the choice that I needed to really make the decision to change my life, to get my health back on track.
Charla had a lap band procedure, which is one of the most common procedures that we do. She's been very successful for her. She lost her predicted weight that she wanted to, and the several different medications she took, she doesn't take anymore.
I decided to have the bariatric lap band at Bariatric Solutions. I have a lot more energy. I strive to do things that I wouldn't have before, experience some exciting things on some of my travels.
A band is put in laparoscopically through small incisions in the skin. We put the band around the top of the stomach, and it's a balloon, essentially. It has a port that goes up under the skin, and we can put salt water in there to tighten the band up. That keeps the food in the top of the stomach and makes people feel not hungry with a small amount of food. It works like a long-term diet, only you feel full with small amounts of food. The most important part of a band patient doing well is frequent follow-ups and getting their band adjusted, especially early on. First 6 months, we will normally do about 5 adjustments until they learn how to use the band. After that, maybe one every 6 months, and then later on, maybe once a year.
My experiences with Dr. Stowers and his staff is so easy. I arrive, I'm seen in a timely manner, in a professional manner, and people are so friendly and they treat me as a family. Each time is very special, and I look forward to seeing the doctor. He's very friendly, very cordial, and very professional all at the same time.
Carpal tunnel syndrome basically is a problem where you have a nerve that's here in your wrist. That nerve shares a common space. It shares it with 9 tendons. When those tendons swell, that soft little nerve gets pinched. The patient can then begin to have numbness and tingling, and if it's there long enough, can notice that his grip strength or her grip strength is diminished. It's important to treat carpal tunnel syndrome early and not wait too long, because the longer that nerve is pinched, the greater the chance that nerve can become permanently damaged if left untreated.
I've been dealing with hand numbness and pain in my hands and fingers for probably 15-20 years. It progressively got worse, and it got to a point where I couldn't sleep anymore. I couldn't write much more than a check out without a pen falling out of my hand. I would run my fingers through my wife's hair and not be able to feel it on my fingers. And you know, I was missing out on a lot. Keeping me up at night or waking me up at night, it would hurt all the way up into my armpits.
When Steve came to see me in the office and he told me his story, it definitely sounded like he had carpal tunnel syndrome. After examining him and after getting a nerve study to confirm what we suspected, it came back positive for carpal tunnel syndrome in both of his hands. So we proceeded to do the surgery to treat his carpal tunnel syndrome.
The procedure we went with was the endoscopic. I could sleep at night now. I can feel my wife's hair whenever my hands are, run my fingers through her hair. I'm doing just about everything I used to do before.
The good thing about endoscopic surgery is instead of waiting this, a long recovery after one surgery for one hand, we operated on Steve within a week and a half after his first surgery. So he basically had both of his hands done in 1 month.
I wish I hadn't put it off for so long. I don't know how many things I put off because I couldn't use my hands like I wanted to before. I can actually feel my hands and do things, and it doesn't hurt to pick up a pair of pliers or pick up a wrench. I'm glad that I found Dr. Ray, and everything's been great since.
Eating slowly will not only help you feel fuller and more satisfied, it can also help prevent indigestion and heartburn. So slow down and enjoy your meals.
Mohs surgery is a surgical technique for the removal of skin cancer that enables us to examine all of the surgical margins of the tissue that were removed so that we're sure that we've gotten all of the skin cancer.
The first time I had any problem was out in California. And I had some work done in here. But the doctor told me, he says it might come back because they didn't have the Mohs system at that time. Then I had this one.
Mr. Wattier presented with a recurrent squamous cell carcinoma involving the right posterior auricular area. The posterior auricular area is the area behind the ear and extends onto the anterior portion of the scalp and the upper portion of the neck. It also involved the posterior aspect of the right earlobe. During Mohs surgery, we were able to get a clear margin. I believe it took 3 stages of Mohs surgery before we had clear margins. The resulting wound was approximately 3.5 centimeters long by 2.5 centimeters wide. What we did was come up with an advancement flap that required removal of Burroughs triangles, small little triangles of tissue at the superior and inferior edge of the wound. We then undermined the tissue, advanced it to the edge of the posterior auricular sulcus, sutured that in place, and then used one of the Burroughs triangles that were excised as a skin graft for the defect on the posterior aspect of the right earlobe.
So you had to do a little patch in there. See, the ears aren't the same. I lost part of my ear here. It's healing up a lot better than I thought.
Well, he's now 4 months post-op. All of the sutured areas have healed very nicely. The skin graft took very nicely, and everything looks perfect.
These make you feel relaxed all the time. It really is nice.
For more information on any of our outstanding doctors or to even request an appointment, check out our website. It's bestdocsnetwork.com. And now we're going to check in with our next best doctor. It's cosmetic dentist, Dr. Guy Lewis.
As I was aging, I guess, my teeth weren't as pretty as they used to be, so I found that I wasn't smiling as much as I used to.
Sandy's a very beautiful lady. A lot of the patients I see, probably the majority of patients I see are women, over the age of 40, who a lot of times, they take care of themselves, they stay in shape, they look great, but there's just some things they want to do to try to look younger. And for Sandy, getting her teeth whiter, straightened up a little bit with the veneers was perfect for her.
I've seen a lot of Dr. Lewis's work and have been so impressed, so I came to see him. And I'm so glad I did, because now I smile all the time.
It just really works great for a lot of people, and she was a perfect candidate for that. It's amazing to me that doing the veneers like we did for her, which is a pretty simple 2-visit process, 2 or 3 weeks apart, what a difference it can make in how someone looks. I mean, literally 10 or 15 years younger.
It's painless, it doesn't take long. Dr. Lewis is very sensitive to your feelings, how you want to look. He's a good listener. He listens to how I wanted my smile and my teeth to look, and he did exactly what I wanted.
It can be done so to where it's not like people look at you and go, wow, where'd you have your teeth done? But they look at you and go, man, you look great. You know, what have you done? Have you been working out more? Or you just look, for some people, if their teeth are really bad, yeah, it's going to be a noticeable change. But for other people, it's just one of those things to where you just look good, you look more alive, you look more refreshed, you just look better, but it's not just a glaring, oh, what'd you do to your teeth, you know?
My family would say, okay, what did you do? Something's different. Your smile is beautiful. Did you get your hair cut? I just feel so good about my smile now. Smiling's good. I'm not a big fan of going to the dentist, so this was a big deal for me, and I would do it again in a heartbeat.
Don't forget, for more information about any of our outstanding doctors you see on today's show, even request an appointment, head to the website bestdocsnetwork.com. That's bestdocsnetwork.com.
And now it's time for our next life-changing story. We're going to check in with pain management specialist, Dr. Jason Williams.
When patients come to see me, they're usually at a point where the pain is starting to affect their daily life, whether it be at work, their personal life, their moods, anything of that nature. They notice that the normal things that they used to do aren't really helping anymore, such as taking medicines that they get over the counter or going to see a massage therapist, chiropractor, acupuncture. All those things seem to be failing, even if they have worked in the past. So at that point, the patients are at a point where they feel that there's something else going on and they need to be evaluated to figure out what is wrong with their low back or neck. When a patient comes in my clinic, first what I like to do is sit down with the patient and learn about what's been going on with them. That's, do an extensive history, spend the time with the patient to find out why they're hurting, where they're hurting, how long they've been hurting. And that's in addition to a physical exam to see if I can't evaluate the nature of the pain that the patient's having. When patients come to my clinic, this is a perfect example of what a patient might be experiencing that could be causing their low back pain or leg pain, or even their neck pain and arm pain. This is a herniated disc, or an example of a herniated disc where the nucleus pulposus, or the center of the disc material, has actually excreted through this annulus fibrosis. When this happens, this can cause spinal stenosis. It can actually impinge upon nerves in the spinal canal itself, or if you can imagine a nerve root coming across this, coming out, exiting to your leg or your arm, and it actually getting pinched off by this herniated or bulging disc. What the Accuroscope procedure does is it addresses a condition like this. The laser energy is focused right here on the actual bulging or herniated disc, where it can reduce the herniation and improve circulation to the nerve and reduce impingement on the nerve, and patients can have immediate improvement of their symptoms and pain.
I am a referral specialist for 4 doctors, and what I do is I receive referrals from other doctors, and then the doctors, they see the patients, and if they tell me that they need to be referred to have a CT scan or an MRI, then we choose the facility, which I prefer preferred imaging, and then I send them an order for them to have either an MRI or CT scan.
Preferred imaging stands out in customer service excellence. I'm able to get our patients in same day, and the patients are happy. They get in, they get out.
I've heard that patients, when they come to the preferred imaging, they feel like they get first-class service and very nice people to work with. and as if they were going into, you know, on a airplane flight. It's first class all the way through.
Because we get the results within 24 hours, we're able to get the patient back right away and the same week. And we can diagnose the patient via the MRI results, and we can therefore know how to treat the patient and go from there.
They're always nice on the phone, they're eager to help, and there's no miscommunication at any point at all. So it helps me when I'm able to call any facility that I can, and then they're there to help, and they're always nice. And it makes it easier for us.
Preferred Imaging has 14 imaging facilities around the Dallas-Fort Worth area, and they do have extended evening hours during the week, and they're also available on Saturday and Sundays. So it accommodates all of our patients' needs, whether they have to go after work, before work, on the weekends. They really make it easy for the patients. We send over an average of 10 to 15 a day. Our experience with Preferred Imaging it's amazing.
The two main types of germs that cause infections in human beings are viruses and bacteria. It's important to know the difference. A virus basically just needs time and supportive care. A bacteria usually and often needs an antibiotic. Viruses are much more common than bacteria. A viral infection usually comes on gradually, whereas a bacterial infection tends to be more sudden. A viral infection tends to cause a lot of muscle aches, whereas a bacterial infection doesn't. The virus does that because it lives in the capillaries in your muscles, and the muscles have a lot of capillaries. Bacteria don't live in the capillaries, and that's why your muscles ache a lot with the virus and not so much with the bacteria. In a viral infection, you tend to have multiple organs involved. For example, you have a runny nose, a cough, and a sore throat. In a bacterial infection, it's usually just one site, like a sore throat only, or sinus infection only, or a cough and bronchitis only. And those are the main ways to tell. Also, a virus tends to have a little bit of a more protracted course. It may last more than 5 or 6 days, and a bacterial infection usually goes away quicker, especially when you take antibiotics.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education, and the Medical Minute tab.
I didn't have Poland syndrome, but it was like it, where one breast is significantly bigger than the other. So I was like a B and a C. It affects everything. The way you dress, the way your wardrobe is, the things you can and can't buy. And as a woman, you want to be able to just go buy it because you like it and you want to wear it, not because of the way it's shaped or formed around your breast area. I just got tired of feeling like that, and I knew that after having a child, it still didn't change. I finally said enough is enough, and I went and saw Dr. Barnett.
Kayla was a special case. This was actually more of a reconstruction than it was simple augmentation. There was nothing simple about that case. She had vast asymmetry in the breast. Asymmetry means one's not the same size or shape as the other. In Kayla's case, this one never developed. And this one was what you'd call a tube sock. Elongated, hanging down. This one was barely there. Usually should have been a two-stage operation. And I told her going in that, I can do so much, but probably you're going to need another operation.
We talked about it and looked at the pictures, and the kind of surgery I needed and required with what I had should have been a 2-step, possibly 3-step operation. And what Dr. Barnett did was just a 1-step operation. And that's all it took.
I was able to, in one stage, create a matched pair. It worked out beautifully. It's been a year now, and she looks fabulous, and she's happy as a clam. Is it rewarding? Yeah, really is. That's a special case.
Dr. Barnett treats his patients like family. He will give you his cell phone number to make sure that you can always be in contact with him. If you ever need anything before and after surgery, I'm happy and glad to know that I safely chose him. I've had no complications. You can't even see my scars. He changed my life forever. It was the best decision I ever made.
Sitting in an office chair all day can be tough on your joints and can cause knee pain. In order to ease the pain, be sure to stretch your legs straight out and tighten your quadriceps 5 times for about 10 seconds. This will help to lubricate those knee joints.
I had been living with neck pain for about 15 years. It took a few of those years to figure out that it was really my neck. It was horrible, lots of neck pain, terrible headaches, nerve pain down my arm. My middle fingers in both hands would go totally numb. Makes it very difficult to work when your fingers are numb if you're working on computers. I had had a bulging disc in my neck. It started out to be just one bulging disc, but by the time we found Dr. Rimlawi and got in to see him, I actually had 3 bulging discs.
We looked at her neck and I said, unfortunately, it was a big portion of her neck. It wasn't just one level. A lot of times people come in, they have 1 or 2 levels. And poor Tara, she had about 75% of her neck that was involved, that had some type of problem in it. She kind of felt that she wasn't fixable. She wasn't able to do the activities that she normally liked.
I couldn't do important things anymore, like my husband and I couldn't go dancing. I couldn't go on walks with my son. We couldn't go play at the park, to the point of not even being able to lift a gallon of milk out of the fridge. The quality of life had diminished greatly, and it was very depressing.
This type of surgery she had, normally it would have a big incision really from here all the way down. A lot of muscle cutting, a lot of bleeding. So there's a little trick where you can go in between this muscle and this muscle, right between them right here, and you can get away with really not cutting or hardly cutting any muscle at all. Cosmetically, it's better for the patient. Pain-wise, it's better for the patient. Recovery-wise, it's better for the patient.
The relief that I've gotten from Dr. Rimlawi and the minimally invasive procedures is such a godsend. It has been such a blessing in my life and has given me the quality of life back.
She's like a whole different person now. That's the best part about this. You see a patient, it's amazing how much neck pain or back pain can change their life and make them into somebody they're not. And then now I see her and she's so happy. That for me is the ultimate gift.
Hi, my name is Dr. Dustin Ray. If you're experiencing hand pain, numbness, and tingling, and it's waking you up at night, you probably have carpal tunnel syndrome. To learn more, watch my videos at bestdocsnetwork.com.
Urogynecology is a combination of urology and gynecology. So we specialize in seeing just females with pelvic floor disorders, anything below the belt. For example, I'm an OBGYN. I completed my 4 years of training in OBGYN, and then we did an additional 3 years of specialty training in urogynecology. So we take care of all the female pelvic reconstructive surgery. So cosmetic vaginal rejuvenation kind of started in my practice because I was getting a lot of women asking me about what can I do. Ever since I've had my baby, things down below don't feel the same. My vagina feels looser, sex isn't as gratifying. And for those women, we can offer a cosmetic vaginal rejuvenation procedure whereby we're tightening up the muscles inside and outside their vagina to make their vagina tighter so that they can enhance their sexual gratification. At the same time, a lot of women will come to me and report that their external structures outside of their vagina is also uncomfortable. It may be bulky, it doesn't match. The lips of my vagina are dragging or sagging. For those women, we can also perform a cosmetic procedure where we do a vaginal labiaplasty, basically to take care of those problematic issues for women. So women who I typically see for vaginal rejuvenation are women who are in childbearing age. They've had kids, and whether it's vaginal or by C-section, oftentimes the pelvic floor muscles will start to weaken. And so the first step is I always encourage women, if you are having any issues, please feel free to discuss this with your OB/GYN or your primary care physician or even a urogynecologist like me. But unfortunately, a lot of us assume that it's a normal part of aging or childbirth, and so then we don't feel comfortable talking about it. But what's nice is that there are certainly treatment options that are available. So the process is nice because it's an outpatient procedure. Downtime, depending on what they're having done, can be 3 to 4 days or up to a week. But then you're back to your normal activities soon after that, and there's very little pain involved. So this isn't a topic that we typically sit around the lunch table and talk about with our girlfriends, but it actually is pretty common. And sexual health is one of those issues that I think a lot of women are embarrassed or too shy to really talk about with their physician. So it's nice to be able to offer treatment options to women and let them know that this is something that we can address.
I had a condition called true gynecomastia, and the condition is basically a hardening of tissue in the chest area. And so unlike some of the other people that have that, it was actually hard tissue, it caused pain, and it was pronounced through clothing, things like that. It was more pronounced on one side than the other, and so that kind of began the search where I looked for doctors for about 3 years.
Gynecomastia is a very common problem for many men where they have the physique in their chest that's more female or feminine, and that's why it's called gynecomastia, feminine breasts on men. And obviously most men are not happy to have breasts, and they want to have that corrected. So they like to have prominent pectoral muscles, they like to show a lot of musculature, but they don't want to have breasts.
So I talked to my primary care physician, and then I started to look at different plastic surgeons in the Houston and the Dallas area. And without even examining me, most of the doctors would tell me the procedure right off the bat, and usually that entailed to do multiple cuts around the area, multiple incisions, and then go in and from all angles kind of take out that tissue. So I knew that that wasn't something that I really wanted to do because it was going to leave a lot of scarring. So I put it off, and it ended up, like I said, it took about 3 years. And the first time I went to Dr. Azouz's office, he told me flat out, I'm going to stay here until we answer all of your questions. And he kind of went beyond that. I mean, he came up with questions that I wasn't even thinking about. And within a few minutes, I knew he was the man for the job. I mean, he actually examined me before he made any recommendations, and then he kind of went through the whole procedure. And the procedure was going to be, 2 really small cuts, which I kind of didn't believe at first, to be honest, because I'd been told by so many other doctors that that wasn't possible, that they would have to do multiple incisions.
And what we do is we take off the breasts by making small incisions under the areola, and through liposuction and sometimes excision as well, we remove the breast tissue and we give them better contour.
Now that the procedure's done, all I have is praise and thanks for Dr. Azouz. Without him, I would have probably gone to one of the other doctors and been unhappy with the results. My life has truly changed as a result of this procedure, and I would highly recommend it to other people.
Well, that'll do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best doctors in all of the Dallas and Fort Worth area that are helping to change people's lives.
And for more information about any of our outstanding doctors you see on today's show, even request an appointment, head to the website bestdocsnetwork.com.
And if you have a question or comment for us, we'd love to hear from you. Send us an email at info@bestdocsnetwork.com.
That'll do it. So long, everyone. Happy holidays. We will see you next week.